NBRST study was begun several years ago to track the relationship between genomic profile and, in the first place, response to neoadjuvant chemotherapy or endocrine therapy. And then in the second place, and perhaps more importantly, the relationship between genomic profile and the patient's long-term outcome, including survival. What we were mainly looking at was a functional molecular subtyping assay called BluePrint. It is a companion assay that works along with the 70-gene MammaPrint assay. What we found in the first place in the NBRST study was that the molecular subtyping assay, the BluePrint assay, was more in line and more predictive for what the chemotherapy response would be. As an example, we found that 17 or 18% of patients who we would think of as luminal type from a conventional point of view, in other words, they were ER positive and HER2 negative, about 17 or 18% of those patients were reclassified as basal subtype. And it made a tremendous difference in the responsiveness to neoadjuvant chemotherapy. The ones who were concordant, in other words, the BluePrint assay classified them as luminal type, and who were ER positive, HER2 negative, had about a 5% pathologic complete response rate with systemic adjuvant chemotherapy, neoadjuvant chemotherapy. But the patients who had a discordant subtype on molecular assay, in other words, they were conventional ER positive, HER2 negative, but the BluePrint assay classified them as basal, those folks had a 35% pathologic complete response rate, which was far more in line with what we'd expect to see in a basal type tumor or a triple negative type tumor. So that immediately puts us in a position to make a better informed decision about neoadjuvant